everyone, welcome back to my channel. My name is Lyna and I have scleroderma. And so today I'm here to share with you my experience, my personal experience with stem cell transplant. I got the bone marrow stem cell transplant and currently it is post 6 months for me. So I'm not any medical professional, so this is just my own personal experience with the transplant. Of course, everybody that goes through it, has very different experiences, and so you have to keep that in mind. So again, just a disclaimer that this is my own personal experience. Also, I should probably mention that I don't know if it matters, quite maybe. I am 28 years old, so I believe, it's the recovery rate may possibly, I have an advantage at that, with that, because I'm younger, so compared to somebody that is much more older, going through treatment. So, okay, let's start. So, let's start with the central line getting insert. So, for example, so I actually have, I don't want to say specific dates, so I just kind of have to go like 1 week later, 2 weeks later type of thing. The first day I got my central line, I actually have it right with me right here. Isn't that interesting? I decided to keep it for just a keepsake and something sentimental. So I just kind of put it up. I wanted to frame it, but it's just kind of an odd shape to frame. So I just been kind of keeping it in this Ziploc bag, and I just kind of put it on a ledge up in my bedroom. What a central line is this, and I had to get it inserted. I still have actually my scars from my central line. So what they do is they go through my neck and then goes through out here, this line. They actually might go, I don't know which hole, I really can't remember, but I think it's this one. So it goes into my neck and then goes out here, and then the red and blue tubes, or I forget what they have a medical name, I just call them tubes, they come out here. And so it's kind of like your best friend throughout the whole treatment. So you get your meds from there, you get your chemo from there, you get your blood work taken from there, so they don't always have to poke needles into your arm, because with scleroderma, well, it's just easier on the patient, because with scleroderma, my body produces a lot more collagen than other people, so our skin is a little tougher. So it's always it always gives like the tech that needs to withdraw my blood, they kind of always have a hard time looking for my vein just because of the tougher skin. So back to the CVC, I get that inserted, and then the next day I get my first dose of chemo. So the first dose of chemo, I was there for about almost 8 hours. There was like 2 hours of chemo, and then there was a break, and then we had to continue on a little after. That's all I remember. And the first experience with that was, I recall a bitter taste in my mouth. And so the hospital, they would provide the patient with drinks. So I always had to sip on something like apple juice or ginger ale, something sweeter, so to kind of cover up the chemo taste, because you can kind of start tasting it. And then also I remember I had like tingly sensations yeah, tingly sensations on my head, and I was almost like drowsy. Yeah, that's what I remember. And like I was so grateful I had my husband with me the whole time throughout the whole treatment, and my mom as well, and my sister as well. So but the beginning, like the first little bit before I got discharged, it was mainly with my husband. So that was my first day of chemo, but other than that, you don't really experience hair loss yet. One thing going into this, I knew I was gonna get, that was the one thing I was most terrified of, was the hair loss, because, you know, it just looks so, I feel like when I see somebody that has no hair, like, I'm like, oh my gosh, like something is, it's just so like visible, and it's hard not to notice. Yeah. So the first week I didn't experience any hair loss. Yeah, it was 2 weeks on, but I was, yeah, so I started notice, I would comb my hair, and then I'm like paying attention, high alert, like, oh, when is this gonna start happening? Because 99% you are gonna lose your hair, and you know, that's very minor in the grand scheme of things, but as a female, I don't know, and a hairstylist, like, hair really just meant a lot to me. But now I don't really regret it. This is a wig, as you can see. This is I'll show you, I'll probably put it up a video regarding my wig collection. So anyways, so the second day after chemo, we were home, and I remember feeling very tired, and I was just exhausted. It was hard for me to talk. Like, it would take up so much energy to just like speak and have a conversation, because I remember the CVC line was like day 3. It was 3 days old, and it was just so, the wound was just so fresh still, and it kind of hurt to move, or I was just very careful, and like, oh, like there was this huge tube and with these 2 spikes coming out. So I was, you know, really noticing that and feeling it, and I couldn't really, like, I didn't want to do too much movements because I was scared, like, what if it falls off or gets infected? Because, you know, that's one thing that they kind of warn you about is infection. Like, keep your CVC line area clean, and when it gets wet, like, change the dressing. Actually, when it's day 3, you don't even change your own dressing yet. Like, you have to go in, and they're really good at making you appointments to have dressing changes and all that, just so you know, because the worst thing is an infection and you're going through treatment. Like, you know, they're trying to kill your, I mean, not kill, but you know, like, bring down your immunity even more and wipe it out. And, you know, your immunity is kind of what heals your body. So if you get an infection, it can be very, very serious. And the worst thing is they have to take it out, let you heal, and then redo it again, right? Like, so you have to be very careful. Anyways, so then 1 week later, after getting my first dose of chemo, 1 week later, they give me, it's called GCSF injections, so to stimulate stem cells in my body. So the point of the first dose of chemo, as far as I know, is to bring down my immunity, right? And then they give me injection shots to do at home, and I have to do that for about 5 days. Sorry, I'm looking at my notes as well because it's hard to remember everything. So 5 days in a row, I had to inject myself with these injection shots, and that will stimulate stem cells in your body. I remember there are some side effects to those injection shots to stimulate the stem cells. I remember I was having some back pain, but it wasn't that severe. Just like kind of like menstrual cramps. So like lower back pains and my leg cramped, but it wasn't to the point where I had to take painkillers. It was still tolerable. I have a really high level of pain tolerance, so I don't know, I just try not to take any painkillers if I don't need to. And then they will take your blood count, and according to your blood count, that will determine the day you will collect your stem cells. So 5 days in a row, you do the injections, and then I guess on the 6th day, you get your stem cells collected. At least I did. And so I actually have a picture. Actually, no, this picture that I have is on the day that I received it back. So I'll show that when I get there. So with the stem cell collection day, again, it was through this line that was coming out of my chest, just like right here. So it's kind of like they would attach, you know, their system to my system. And then it draws the blood out. It's kind of like blood work. They're taking blood work, and then they have a machine that will separate the stem cells from your blood. And so that your blood goes into this machine, it spin, and then it separates your stem cells away from your blood, and whatever the blood that isn't used, it goes back into my body. So they really only just collect the stem cells. That took about 4 hours, 5 hours, I think. It just really depends. Everybody's really different. It depends how much, according from the injections, how much your body reacted to it. And of course, like, they will have a target for everybody, and according to your body weight and size, they set different targets for everybody. So they collect the stem cells, and then after they do, it's like in a blood bag, and it's like orangey. I have a picture of it, so I'll show you later. And then they would put it in like a lunch bag, like a freezer bag, and then quickly go and freeze that, and then I would be done for the day for my stem cell collection. That would be my day. So yeah, so they would freeze it, and they won't defrost it until 2 weeks later I get my stem cells back.